Dr. Moghanaki, can you discuss any disparities or differences in health outcomes among veterans compared to the general population when it comes to lung cancer treatment?
Yeah, when it comes to lung cancer treatment, there's new data that's showing that since the discovery of better drugs and safer surgery and more effective radiotherapy, that survival rates are improving gradually, especially over the last 10 years. We've seen this same trend with VA data as well, that veterans, whether they're getting care in the community or in the VA, the outcomes are getting better. Are there disparities? Well, there's a notable disparities that we've identified, which is that although outcomes in general are getting better for female and male and Black and white and other ethnic sections of the population, there continues to be a disparity in the civilian sector in that our Black patients, whether civilian or veteran, have inferior outcomes. And of course, we know this is associated largely with other socioeconomic issues related to a long history of racism in this country that's led to segregation and unequal access to healthcare and well-being opportunities. But what we see in the VA, whether you're Black or white, actually the outcomes are the same. So there's something that VA is doing that's addressing the barriers that are affecting people in the general population. And in fact, we see in some of our studies, Black veterans actually have better outcomes. And so, we're learning that it's much more than just biology by itself, that there really are socioeconomic factors. And when you've got a healthcare system that's more than just a healthcare system, it's a benefit system as well, we really provide a nice safety net that helps address those disparities. But the sad truth is that it definitely disparities do continue to exist outside the VA healthcare system. So my activation tip is, if you're a veteran with, maybe some, less resources than others, again, check into the VA, because the VA provides not just healthcare, but also a lot of support services, especially when you have lung cancer, which is mentioned, it's just very difficult to deliver and requires more than just access to a doctor.
And I'd like to mention a paper also that you published regarding improving outcomes over a certain time period. Are you willing? There was a paragraph in there where you had a discussion about potential contributing factors to the improvement of outcomes over time. Are you willing to discuss those a little bit, what those potential factors are for improving outcomes in patients with lung cancer?
Yeah, there's three main components. One is making sure you get the diagnosis right, making sure you do the right biopsies and you send the specimens for what's called biomarker testing to make sure you know what type of lung cancer. There's now more than a dozen different types of lung cancer. And if you don't get that biomarker test, you're not going to know. You're just going to be treated with standard therapy. If you get the biomarker testing, you can get personalized medicine with a drug that's more likely to work and probably safer than older conventional chemotherapies, which still has a role, but sometimes we can skip chemotherapy altogether and go directly to a targeted therapy. The second big advancement comes in the treatment delivery itself. So surgical treatments are now much less invasive than ever before. In fact, many of our patients, they go to the operating room and wake up with 4 Band-Aids and half their lung is removed. It's remarkable technology using robotic and video-assisted technologies. Same with radiotherapy. Patients lay on a table and a machine, very sophisticated machine just rotates around them, zaps these tumors. Patient can actually drive themselves back and forth to treatment and go home and live their lives. We got patients getting lung radiotherapy and they're playing golf the next day. It's unbelievable. And then the third really comes down to survivorship, which is that our patients, even if we really can't cure their cancer, like a lot of their advanced diabetes, we just can't cure. We can keep our patients going to live a high quality life moving forward and make sure that their journey, unfortunately with their lung cancer that they obviously didn't ever want to have, that their journey is the best that it can be. So my activation tip here is if you've got cancer to really lung cancer, to really appreciate that there's been a lot of advances. And if you're not feeling that you have access to those advances, get a second opinion and go to a bigger place that actually has an integrated approach to lung cancer care with a multidisciplinary team with the doctors in different specialties are working together and are focused on giving the best lung cancer care.